Hello and glad to have you join us on another edition of Health Options. I am Rabi, Abdallah. It is 40 years of Alma-Ata Declaration, which was adopted in 1978 by more than 100 countries that met in Almaty, Kazakhstan, formerly known as Alma-Ata, after which the declaration was named for the International Conference on Primary Health Care. The declaration set forth the guidelines and precedents for which Health for All by 2000 was planned. The Alma-Ata Declaration defined health as not merely the absence of disease, but rather a state of complete mental, physical, and social well-being. Under the declaration, officials identified 8 categories of public health care which would have to be addressed by governments. They are maternal and child health, public education, proper nutrition, clean water and sanitation, immunization, local disease control, accessible medications, and drug provision. As we reach a major landmark year since the declaration was adopted, this edition of Health Options takes a look at the progress made so far, especially where Nigeria is concerned. Welcome to the program. This is Health Options, and we're taking a look at 40 years of Alma-Ata Declaration and adoption by countries. We begin with this background report on the state of primary health care in the country, put together by Aisha Ovali.
Shortly after the country's independence, the country's health focus was mostly on curative rather than preventive medicine. Until 1985, things started changing under the leadership of Professor Ransom Kuti, who was then the Minister of Health, with a comprehensive national policy launched in 1988. The mandate of the Primary Health Care Initiative became visible at the grassroots. This brought to the fore the basic essentials such as ensuring immunization for children, adequate breastfeeding practices, and oral rehydration therapy by nursing mothers, among others. By 1992, the National Primary Health Care Development Agency was established to serve as a support system of the focal agency to implement the initiative. Even though health is on the concurrent list, the implementation of primary health care has mainly been seen as the responsibility of the local government. Unfortunately, through the years, fortunes of primary health care nosedived as it became poorly managed and virtually decayed. At present, there are about 30,000 primary health care facilities scattered across the country, but surprisingly enough, only 20% are operational. Analysts believe these could easily be traced to some factors, which include lack of personnel, poor working conditions, obsolete equipment, poor funding, lack of political will, as well as policy inconsistency. Nonetheless, in 2011, a new policy was launched. This sought to resuscitate the primary health care called Primary Health Care Under One Roof Initiative. However, recognizing the need for adequate medical attention for Nigerians at the grassroots, especially women and children under the age of 5, the present Minister of Health, Professor Isaac Adewale, announced the commitment of the federal government to change the story for good and prioritize healthcare delivery in the country with allocation of more resources. It was at the inspection of a health facility in one of the rural communities in the FCT that the minister made this known. He said funds are being provided to uplift 110 primary health care facilities across the country. In addition, the minister said the revitalization of the primary health care centers in all the senatorial districts is expected to be replicated in 10,000 electoral wards in Nigeria. The aim is to ensure that a good number of Nigerians, particularly at the grassroots, have access to quality basic health care service and a renewed vigor in the revitalization of the centers. It is pertinent to ask how far the attempt to revive this sector have gone? What role is each stakeholder playing to change the sad narrative of primary health care in the country? Is there a role for private sector? To what extent is funding shaping the new thinking for primary health care in the country? What is the place of Alma-Ata and the 2011 Abuja Declaration, which requests that countries reserve 15% of their annual budget to health?
Many thanks, Aisha. And joining me in the studio to discuss 40 years of Alma-Ata Declaration, adoption and progress made so far as it relates to Nigeria, is the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shaib. Glad to have you again on Health Options, Dr. Faisal.
Thank you for having me.
Yeah, so much talk about Alma-Ata Declaration and its 40 years of that laudable declaration. Can you just, in summary, give us what it is all about?
Right. So some 40 years ago, governments, heads of states, ministers, and development partners globally converged at Alma-Ata and made a very visionary and ambitious declaration around primary health care. Last week, on the 25th and 26th of October, there was a meeting of different stakeholders, again to reaffirm the principles guiding the Alma-Ata Declaration of 1978. This was around the fact that governments and societies needed to continue the process of promoting, protecting the health of all individuals and communities by strengthening primary health care. It was also around those key tenets of primary health care, around the fact that there should be an improvement in the quality of primary health care. Primary health care should be provided in a way that is safe, in a way that is comprehensive, is integrated, and it should be provided by health workers who are well-trained, who are skilled in a way that is compassionate, in a way that treats patients with integrity and respect, right? And at the end of it all, it was an opportunity to reflect on 40 years and the kinds of progress and challenges that still remain in the primary healthcare space. Yeah, I was going
to that. Based on the evaluation, because you cannot be marking a landmark and you don't evaluate to see where where you were coming from, the hiccups and where to improve upon. So what were those things that were brought to the fore?
Right, so the conversations were around, again, the progress that has been made, the remarkable progress that has been made in many countries, especially a lot of developing countries around child survival, around reduction in maternal mortality. But of course, we know that in Nigeria, we've not been able to reach the mark like we would have loved to. We still have a high level, unacceptable levels of maternal and child mortality. Nevertheless, there's been some progress. But where we find ourselves today in primary health care has been due to several decades of neglect, right? During 1978, when that declaration was made, the whole vision was around making primary health care the core, the cornerstone of all health services, in a way that from the primary health care level, no matter where you live, at whatever time of the day, you have access to quality health care.
Okay,
right?
I'm aware that the then former Minister of Health, that's late Professor Olukoya Ransom Kuti, made tremendous effort in that regard, and somehow we had some setbacks that kind of dragged the progress backward. But I know that the Muhammadu Buhari administration is making concerted efforts now to reposition primary health care, and hence the revitalization program of the current administration. Where are we in that regard? How far have we gone?
So right, so we've made a lot of progress working, not just government, not just the federal government, but state government, development partners, and the private sector. We're at a point where from 2015, close to some 4,000 health facilities have now had some form of renovation, some form of resources plowed into that sector, right? Again, we have close to some 30,000 primary healthcare facilities, right, that need to be upgraded one way or the other, right? And we've made a lot of progress, and we continue to make huge landmarks when it comes to renovating and providing human resources to those health facilities. This is very, very central to this government, that in each and every ward there should be one primary healthcare center where people can walk to and get basic health care. And where those health facilities are not able to manage the condition, there should be a referral process to the next level of care. Now, once we're able to provide that level of quality health care, no matter who you are, no matter where you are, in a way that does not lead to financial hardship, that is universal health coverage that the federal government is talking about. And this is why the Basic Healthcare Provision Fund, close to over 55 billion naira, will go towards making sure that pregnant women, women who have delivered, children under 5, vulnerable groups, the aged, will be able to access healthcare without becoming poor because they are paying out of pocket. And this is why in a lot of places, people go to health facilities. They are either unable to pay for healthcare, or when they do pay for healthcare, then it ruins them financially. This is the whole concept of providing universal health coverage, and this is very central to what President Buhari is doing.
Okay, still on the rural populace now. There's been so much talk out there about the fact that, yeah, the infrastructure is there, talking about buildings now, but we still have to contend with situations whereby you go to a primary health center and you don't have the full complement of what is required in a primary health center to make it fully functional. Why is it so? At what point are we going to start seeing all of that?
Right, so this has happened due to several decades of neglect, right? So after, like you rightly mentioned, the early parts of the 80s and 90s, when primary healthcare was the center of our healthcare system, we had many years of military rule where there wasn't a lot of investment in primary healthcare. Right? Yes. There was a lot of focus on tertiary care, sophisticated medicine, right? But the most basic healthcare was not funded. That is the situation that this government met before 2015. And that is why when the president came into power, he said primary healthcare will be the focus. And you can see very clearly that there are targeted interventions to ensure that we're not trying to fund every primary healthcare facility. We're not trying to renovate every primary healthcare facility. Can we start from just one primary healthcare facility in a ward where people can get the full complement of the services that they require? And then we can gradually, grow into more primary healthcare centers that can provide all of these services. Because if you are able to provide those basic healthcare services, then you promote and you protect the health of people, then fewer people will fall sick and require more complicated health care. That is where we are. This is a government that has spent the last 3 years focusing on primary health care. And this is why you can see that in so many places, right, we are beginning to get improvement in our health indices. So I'll tell you what some of the data is showing. In the last 3 years, we've seen for the very first time, after several decades, that immunization coverages are beginning to go up. 10% in 3 years. Unprecedented globally. Most times, when you look at the data, the best case that we've seen is maybe some 6% jump annually when you look at how people move from poor routine immunization coverages to better routine immunization coverages. But in the last 3 years, we'll be able to have a 10% jump. That is something that even the government is not saying so much about, right? But that is an achievement that is unprecedented, even on a global level. And I think we should give we should acknowledge what Mr. President has done in terms of providing the support, and also the leadership provided by the Rabi Minister of Health. Okay,
let's talk about polio now. I know that we had some setbacks, but we seem to be on track at the moment. But let us into the occurrence in Bauchi. There was a rumor in Bauchi about polio, virus.
Right. So again, because this government met a situation of very low routine immunization, I always say that for several years, the government was not really owning up to the fact that routine immunization was not doing very well, right? So routine immunization coverage from surveys showed that we're around 33%, right? But several governments did not own up to the fact that it was just 33%. There was falsification of data at all levels that routine immunization coverage was around 90%, 98%, right? But when this government came to power, we said, the survey says it's 33%, we'll accept it, and then we'll see what we need to do to build, right, to improve routine immunization. The reason why we've had a polio virus in Bauchi State, in Jigawa State, in Yobe State, is due to low routine immunization. But this is not the wild polio virus. So there's a distinction between the vaccine-derived polio virus that was isolated in Bauchi and some other states, right, and the wild polio virus. We've gone over 25 months now without a single case of wild polio virus. Do we need to go? So fingers crossed, right? Yes. If we're able to access most of the kits, some 70,000 kits in the Borno and Yobe area, and we do not find wild polio virus, then we are on the edge of being declared polio free. So we're looking at maybe the next 11 months, right? That will make it 3 years completed without a single case of wild polio virus. So there's a lot of excitement that this will finally happen to us in Nigeria, that nowhere will any child be paralyzed from wild polio virus. But above and beyond the declaration that we are polio free, there's been a lot of effort on the part of this government to strengthen the health system. So it's not just polio, it's not just routine immunization, but we're now integrating all of these interventions into primary health care so that we have a stronger health system that takes care of every single basic healthcare needs of the populace. Okay,
that takes me to the next question. You remember early in the year, the president launched an initiative in Nasarawa State, CHIPS, right?
That's correct. That was in February.
Yes, and I told you then that we look forward to you giving us an update on progress made. And since you are here now, can you let us into that? How far
absolutely.
Have we gone?
So that is another exciting intervention in the health sector that the president has made. The CHIPS program, an acronym for community health, influencers, promoters, and services program, is designed to, again, strengthen primary health care, right, at the community level through the participation of community members, identifying women who can go from house to house and provide basic health care, right? We've rolled out in Nasarawa State, in some of the LGAs in Nasarawa State, and then we will move next to Jigawa, to Kano State. We're having conversations with different states depending on their level of preparedness. But really what has been exciting about the rollout of the CHIPS program is that we're focusing not only on health, but some of these women that we've met in the communities have actually worked in the past on the polio program. We know that we're going to eradicate polio, right? But what happens to them? All the skills that we're giving to them, here's an opportunity for them to now put it in their communities. They've learned how to move from house to house. But we're also empowering these women. We're teaching them life skills so that even apart from providing health in the communities, they have income generation. For those who do not have the educational requirement, we're linking up with the Federal Ministry of Education to also educate them. So you can imagine that it's a real composite sort of intervention that looks at the woman, that gives her skills around health, helps educate her, income generation. And she's doing it in a way that is volunteering, and she now becomes sort of a role model for a lot of young girls in the communities. Right?
And we know how far women could go when they are in charge, right?
Absolutely.
So thank you so much, Dr. Faisal, for coming on Health Options.
No, it's been my pleasure.
All right. According to UNICEF report, child survival and disease control, including oral hydration therapy, ORT, and zinc supplementation to treat diarrhea, basic immunizations for common ailments, micronutrient supplementation to treat malnutrition, and more, save the lives of approximately 6 million children under 5 each year. Check out our health tips on essential steps for improving child survival.
Starting from the first few days of a newborn life, which is very critical because the child can easily get sick. The care of the umbilical cord is very important. In the first day, chlorhexidine can be applied, and the cord, it's important to not use harmful substances such as applying mud, cow dung on the stump. Breastfeeding is very critical to the survival of the child. This is because breast milk contains a lot of important nutrients that keeps the child healthy, builds the child's immune system. Starting from the first hour, within first hour of birth, the child should be put to breast and exclusively breastfed for the first 6 months of life. That means no water should be given or any other fluid or substance, except for medicine or drugs that are prescribed by a health practitioner. Another key survival strategy for a child is immunization. Immunization is very important to a child's survival. There are several immunizations the child should get within the first year of birth. This helps the child survive by keeping away preventable diseases. At the from birth, the child is given BCG to prevent tuberculosis, polio, to prevent poliomyelitis, that's what causes disability in children. The child can also get hepatitis B. After that, there are other vaccines that are also key to a child's survival, such as the pentavalent vaccine. This vaccine keeps children from getting disabilities that result in deafness, in cough and other complications that are detrimental to a child's growth. Now, as our child is growing, under the age of 5, there are common sicknesses that can befall a child, and this can affect our child's health in a way that is detrimental to his or her survival. There are things that can be done to prevent these sicknesses, and there are things that we can do once these sicknesses occur to help our child survive. Commonly, at that age, children are prone to diseases like diarrhea diseases. They can also come down with fever, either due to malaria or other causes. Commonly, children also contact respiratory tract infection, mostly diarrhea, in which the child has fast breathing, and complications can occur that can lead to a child's death. This we can prevent by ensuring good nutrition in our child to build the child's immunity. There are also supplements that are given to children, such as vitamin A, that can build the child's immunity and help prevent diarrhea and some of these other infections. If a child happens to come down with diarrhea, it's important that we give the child oral rehydration solution, that's commonly known as ORS. This keeps the child from becoming dehydrated. Giving a child with diarrhea the salt sugar solution or the oral rehydration solution is very key to his or her survival. This is because it keeps the child from getting dehydration. It reduces the chance of that child dying. It also contains important minerals that helps our child survive. This should be given prepared in a hygienic manner and given to the child as frequently as the child can take. And this child should be taken to the nearest health facility for further treatment if the condition worsens.
And it is on this note that we wrap up this edition of Health Options. You can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdallah. Many thanks for your time.